You're going to be recording. There we go. We're going to be recording these meetings from now on, and we will have them available on our website in case anyone has to miss one, so that you can like see all the discussion that we had in the updates. So it's a quick update. We also are going to give you an update on subgroups. I know it's been a long 3 months since we've reached out to you, and I will tell you why. I'm going to tell you a little bit about an exciting opportunity we have with the parenting education curriculum, and then Darcy will give you an update on our website. So I worked with IT at CRT for about like 2.5 months, and it became very obvious that while it would be possible to put everyone on teams as we voted, it would require so much work on the back end. You guys would need to be IT experts, and I know I'm not up to that task, so it just became like, this is not going to work. So Karen actually suggested in one of our team meetings that we look at Jamboard. And so this is an example of what the screening Jamboard. I started it, obviously I haven't sent it to anyone, so this is just what it looks like. Jamboard is a virtual digital interactive whiteboard where you can color, draw, post pictures, put sticky notes. So it's like a bulletin board that we can communicate. It basically does what we wanted teams to do. So thank you again, Karen, for the suggestion. We will be sending out an email after this meeting that will have information about Jamboard. It will have links, tutorials if you need them to see how to use the Jamboard. It's also actually going to include a link to our newest council newsletter, as well as a flyer for an exciting group we have and information about our website. So look out for that email, and then you should hear from your staff liaison by the end of this week with a link to the actual Jamboard for your subgroup. So that is the update on that. We are going to be offering STEP intervention. STEP stands for Systematic Training for Effective Parenting, and it's a multi-component parenting education curriculum. So the program helps parents learn effective ways to relate to their children by using parent education study groups. And so it helps to identify the purposes of children's behavior, helps parents learn how to encourage cooperative behavior, how not to reinforce unacceptable behaviors, how to change dysfunctional and destructive relationships with their children by offering concrete alternatives to ineffective methods of discipline and control. So these parenting groups will be run by either our staff will be trained in them, and we could come to your organization and run parenting groups, or we can train your staff in them. It's an online training that's accessible for 6 months. The training is 6 hours long, and it's completed independently. So you don't have to sign up for a specific day. Once the training is complete, you get a kit for your organization that has booklets in it, a leader's resource guide, a DVD, and then we will help provide parent handbooks as part of the program to your organization. So if you are interested in signing up for this, please reach out to me. My email's here, and let me know. I'll be keeping the list, and I'll be following up with details with everyone.
Okay. Can I just add a couple of details here,
Yes.
Emily? Okay, so just to clarify, this is the parenting intervention training that we're providing instead of the triple P training. So we've kind of tweaked what we're doing this year. So this is the evidence-based training that we're providing, just to clarify. So if you're interested, just like Emily said, just send her an email if you want to do this training. Okay, so we're making we have 20 slots available for folks, so we have plenty of room. Okay, thank you.
All right, thanks, Anne. And now, hold on, I'm going to turn it over to Darcy.
Okay, website update. Our website has been revised and the new version is up and running. Yay. And the new website, it's been redesigned from the old one, so it looks different, and we're continuing to work on that. We have a long list of edits and changes that we're going to be making to it, and we're certainly open to any suggestions from any of you on things that we can add to it or do to it to make it look better. But the URL is projectlaunchsouthland.org. And the focus of the website is to highlight the collaboration and partnership that Project Launch has formed with this council and with all of the community partners. So those are listed. You'll see on the very first page a calendar that is designed not to include everything, but to highlight any key events that focus on young children, health and wellness events that focus on young children. And we've been updating that just by scanning already posted events from our Southland communities, but we would love to include anything that anybody else has. So feel free to send any events you'd like to be posted up there directly to me, and I will throw it up. And anyone else in your organization that is involved in calendars or scheduling events or tracking events, send my request their way, because I would love to put up whatever we can find. In addition to that event calendar, there are a lot of resources for parents. There's a lot of information on milestones and common conditions, so that parents can go and review and see, is this something that I'm dealing with? And if so, the most important feature of the website is a list of providers that they're organized by the same conditions that are listed in the parent information, and say you need support in whatever, anxiety or support for any condition that you're looking for. They're organized in that way. We pulled those events from NowPow, so they're updated every 6 months. And we think that this will be a really good resource for families to be able to quickly find support. In addition, there's an easy way to contact us, contact Project Launch. You can sign up for trainings, information on trainings, and a direct link to our Family Navigator if those are the kinds of services you need. So everything in one place, which we think is great. And as I said, we welcome any suggestions, ideas, other things that we can post here that will be informational or supportive to the families in our south suburbs.
All right, great. Thank you, Darcy. I started clicking and forgot I was running the presentation. So, okay, there we go. All right, Denzel, do you want to do the intro for Kenny?
So as I mentioned, it's exciting to announce that Aunt Martha's is celebrating 50 years of leading the way of health and wellness services within the Southland and Chicagoland area in general. So today we have a presentation that we're extremely excited to have Kenny Martin, who's, as I mentioned, is the Senior Vice President of Community Integration and Health Services. So without further ado, I'm going to pass it over to Kenny. And Kenny, you have screen sharing capabilities, so you can go ahead.
Thank you so much, and good morning again, everyone. Let's make sure we do this from the slideshow. Okay, so I'm assuming, but I don't want to assume that many, if not all of you, are familiar with who we are and how long have we been in the communities, really serving and hoping to make a dent in improving the quality of life of those that we serve. This is our mission statement and really describes that we are committed boldly to supporting the well-being of our communities. We really focus on equity and access, and we pride ourselves in delivering exceptional care through a culture of innovation. And it's important because I'm going to be referring to this as I described to you, specifically what I want to talk to you today about, which is our model of care. And our model of care is integrated care. But a little bit of our history, as we are, in fact, this year celebrating 50 years, we were founded originally as a drop-in center for youth. And it was a group of folks and volunteers that were really concerned about the number of youth that were being displaced or disconnected or entering the child welfare system, and decided to come together and named it Aunt Martha's because Aunt Martha's was sort of like this character figure that suggested warmth and safe haven. And so that was 50 years ago. And from that time, and since that time, we really have expanded our service range to do a whole lot of other things that really help with the development of those youth that we were serving. And so we were doing youth development services and parent support. We, for a moment, had many sites operating Head Starts. We still have a juvenile justice program. We still have a very expansive crisis intervention program. And then we went into the child welfare arena as well with foster care and group homes and intact family and all of those other services. It was actually 99 that we opened our first qualified health center. And we began from then operating or developing what it's now called our integrated care model. Just a very overview of our reach. What you see in orange is really the number of counties that we're able to reach, not necessarily by location, but simply by innovation, by technology. And these are folks that we are able to serve primarily through telehealth. It gives you a breakdown of the population that we serve. And as you can see, it's primarily Black and Latino, with a lot of folks that are uninsured, but the primary payer for them is Medicaid. We have over 800 employees, we're pretty large. And even though we have about 75,000 patients, we would say it's over 115,000 folks overall that we impact throughout the state. This is just a rundown of some of our locations. Some of them are co-locations with collaborations with other entities. Some of them are in hospitals, as you can see. But it just gives you a sense of the range of services and communities that we have, and some of the specialty populations like the developmentally delayed population in Palatine, or the homeless population, or the substance abuse population. A whole lot of different communities that we serve throughout the state, as far north as Rockford and Winnebago County, as far south as Danville, and as far west now as Peoria. This gives you a sense of the history, if you will, of the evolution of our integrated care model. We began, as I said to you, in 2003, when we began expanding behavioral health access through our primary care, and we began integrating some different types of assessments and screenings that were part of the primary health care workflow when actually conducting a physical, to determine beyond the physical health issues that you present, what other things are we looking at in terms of anxiety and depression? What other things in terms of social determinants like housing, employment, legal issues, support systems. So we've continued throughout. Telepsychiatry was something that we were able to capture early on. And so it has grown exponentially in the last 24 months, primarily as a result of COVID. And part of this is also an introduction into our model of business, which is a shared risk saving business, which is very much value-based oriented, in which we really are not looking for payments based on fees for service, but rather on outcomes. And today we really enjoy being able to be a network leader in care coordination and reducing medical loss ratios. So it has really, for me, on a personal level, has been a really wonderful journey to be here and to be a part of this growth and this unique organization, because as I said, from a community-based organization, then bringing in child welfare, then bringing in healthcare, it really is incomparable to any other organization that I know that has been able to do that at this level and in this way. What is also important is to know all of the different services that we have and how they intersect. So within health, you have all of those services that you see there, not everywhere, but in many of them. There are, in fact, some locations that are large enough where we can actually have all of these services. But some of them are also specialized. As I said, behavioral health will encompass all of these other issues that we're looking at, psychiatry and crisis intervention and therapy. And then social determinants, all the things that I spoke about in terms of the housing and the employment in the school. We're looking at all of these systems to figure out how are they impacting someone's ability to get better, remain in that state. Because if we have someone who is a diabetic and is having some issues with depression and whose housing is compromised, their ability to really look at their diabetes condition and manage it well is going to be diminished if we don't also pay attention to those other issues. So we want to make sure that we're providing all of that. Specific to behavioral health, in a traditional model of healthcare, patients that present with mental health challenges will see, few of them will see a mental health specialist. Only half of them with depression will actually go undiagnosed. A third of them will actually be untreated or will be treated rather, or will receive inadequate treatment or minimal treatment. Whereas 2/3 of them report that they'll have very little access to services. For us, primary healthcare is behavioral healthcare. Our shared care plan includes this series of screenings and assessments and treatment that is managed by the primary care physician. The primary care physician is sort of like the center of that service. The primary care physician will consult with the psychiatrist, but the psychiatrists that we have mostly focus on really complex issues, acute issues, folks that are decompensating, folks that have some issues with chronic disease management. But by and large, we will have RPCP who are trained on the integrated care model and on behavioral health be the ones that lead that with and in consultation with the psychiatrist. We use brief intervention therapy to support folks, to get them to stabilize, and then we may use other services and resources in the community to help continue that process. Currently, our telepsychiatry represents 90% of all psychiatry visits. We really believe in and have found that they improve patient access. They increase the productivity of our providers as well, and it really helps in integrating, enhancing integration. We have been expanding, as I said, behavioral health access through primary care. These are some of the screenings that we use, and some of you may be familiar with them, the PHQ-2 or the PHQ-9 for depression, the GAD-7 for anxiety, the SBIRT, which is usually for alcohol and substance abuse. Telehealth is really, again, the main technology that we're using, but we will look at all of these other social determinants to really figure out what other things are getting in the way. Care coordination is the function that brings it all together. So when we have folks that are sort of stratified at a high risk level because of these issues being unresolved or unstable, they'll receive care coordination services. So we do it through this risk sharing model with the health plans. And this is just a basic sort of stats on how the outcomes rather of the program of the service. So 10% average number of patients that we have move into remission after having registered with depression, move into remission each month. 60% of patients with diagnosed depression experience a reduction within 90 days. 77% experience a reduction of 5 points or more on the PHQ-9. And 87% of them are managed and regularly treated by the primary care physician, not by the psychiatrist. But that you see there on your left, it is the entire team that we have. So we see folks that sometimes go to the hospital. Post-discharge, we'll immediately connect them. Post-ER visit, we'll immediately connect them. We have specialists, and then we have a panel management team. And this is sort of like the model of care coordination. again, through these ongoing patient assessments, we're doing this risk verification. We're really ensuring the patients are connected to their PCP. We're using electronic health record to coordinate between us and all the other providers. You saw that we are in many hospitals. We are also not in all hospitals, but in some hospital networks in which they're using us for post-hospital follow-up or for discharge. And we really want to manage the patient care plan with the patient. This is about the patient with the proper information, being able to sort of take ownership of their own healthcare as well. And that is all I have, but I welcome any questions. And I went really fast because I only had 10 minutes. It's funny because it usually takes me about an hour to do this, but I want to be cognizant of everybody's time.
Well, thanks so much, Kenny. And I truly appreciate that. Though it was fast, it was very informative and some really good information. So I'll start by asking a quick question and just kind of giving you a little background of the challenges that we're facing as it relates to mental health services within the Southland. So as I'm sure as you know, there's a supply and demand issue that's really been a challenge and a hurdle for many organizations, school districts, municipalities. It sounds like one of the ways that Aunt Martha is looking to address that is through telehealth services, allowing you guys to service more via telehealth or telepsychiatry. So if you can speak a little bit more on that, and am I accurate to say that that is Aunt Martha's approach to kind of helping address the supply and demand issue?
That is one of the approaches to, and not only to addressing supply and demand, but to addressing access. You know, one of the things that, so again, telepsychiatry is something that we have been doing for quite some time because there was a supply and demand issue. We had a very limited number of psychiatrists available, and we meaning the entire healthcare field, right? Not just Aunt Martha's. And so for us, it was a matter of having, in order for us to have the ability to impact those areas in that map that you saw as far north and as far south beyond sites, was to do so through telepsychiatry. And what is interesting is that at first we were concerned that because of the lack of personal touch, that people would not respond well. And what has happened actually is that people have responded even better because they find themselves less intimidated by the process. Perhaps the digital environment creates sort of a safety net for them in which they can feel like, yeah, I can be myself. I'm not going to feel necessarily the judgment that I might feel, or I'm not going to feel as intimidated by the process by just having this conversation. And some people just find it kind of cool and remarkable that they're using technology to access. So they have actually, and our no-show rate has actually been lessened as a result of that. Once COVID hit, and by the way, we were on the works for telehealth legislation along with many other folks in the healthcare field way before COVID. But I don't know if you know this, it was just sitting in legislation. It didn't have a whole lot of interest. It wasn't as attractive. Once COVID hit, it was not only attractive, it was needed, it was urgent, and it passed quickly.
Yep.
Which is sad that we would have to be reactive rather than proactive. Nonetheless, we were able to then sort of use the same principle and say, we know that either some of our clinics are going to be affected by folks being infected by COVID, and I'm talking about our own staff and doctors, and or some folks may not want to leave their home because they're afraid of coming to the clinic. And so we said, there's a whole lot of services and conditions that we can connect to and or serve and or handle through telehealth. So we should be able to do that. And we do that even with new patients. So it isn't necessarily all the time with established patients, though usually with established patients, with new patients rather, we prefer to see them first in person. If it is impossible, we want to make sure that you have access. and that we'll get to see you, but let's find out exactly what you need. And if tele is what we can offer you, we'll do that.
Absolutely.
We've had, I don't know, 3 weeks of snow issues where when we are, experiencing snow alerts, like weather related issues, a team of us gathers, because as you know, we have clinics all over the state. So we have to look at what regions are being impacted and what regions are being affected, and which clinics do we actually have to close or open late or close earlier, and all that, and how many appointments are not canceled, they're moved to tele. Because then the providers don't have to be there, they can stay home and they can do it from tele. So, to your point, it's about access. It's about really optimizing technology to ensure that folks have access.
Has access.
Hopefully that answers, yeah.
Absolutely. Thanks so much.
Someone else had, I'm sorry, something in the chat. Are you concerned that the insurance providers and state leaders will turn back? That's a very good question. We were, we were before Delta and before Omicron. Once Delta and Omicron came, they're like, no, we're not going to even bother reversing this, because we are now living in this uncertainty of variants that, and first and second, we never achieved herd immunity. We haven't, sadly. That means that the opportunity for infection, transmission, it's still very much out there.
Have you heard anything though, like policy wise? I mean, I guess I'm worried that we're all kind of hoping and continuing, but it feels like at any minute, especially the insurance.
No, I think it is, and I think of like Representative Rick Harris, who is very much akin to this technology and using it for access. If it has helped increase access, the last thing we want to do is move it away. Having said that, Colleen, one of the things that I'm looking at, and some of you may know of this, is that the focus is, or a focus is going back, is rekindling in the community health work arena. Remember, that was the impetus and the genesis of federally qualified health centers back in the 60s. And then it has had its ebb and flows. Now it's resurfacing again, because we are finding that is perhaps one way in which we can establish relationships of trust with people who are still having issues with vaccination, because for us that also means other issues about access to healthcare. It isn't just about I'm an anti-vaxxer. It's about where are you at with understanding how to, when to, why to access healthcare, and how does a community health worker help impact that someone at a clinic may not be able to. So that is a new, not a new, but a resurfacing or a rekindling, if you will, of that service line, of that point of contact, if you will.
I would like to jump in here right now. Kenny, thank you so much for the information that you provided. And I would like to ask the educators here about your referrals to Aunt Martha's with your students, or your experience with making referrals to Aunt Martha's or to other community mental health providers, and how that's gone, since that's a key focus of Project Launch. How's that been, especially since the pandemic?
I can speak. We actually haven't, through our home visiting team, referred to Aunt Martha's at all, but I am very familiar, Kenny, and I appreciate everything that the organization does. In terms of community resources, we've been doing a lot of referrals during the pandemic, and we've had success with them to our local agencies. Arab American Family Services helps us out a lot. I know there's ABA has been mentioned. We have some different autistic therapists that we've been able to get supports from. So we've been having good luck with a lot of our resources in the Oak Lawn area.
So,
I'm going to add Martha's to my list though, Kenny, because obviously we know that sometimes different resources get filled up and we need some other outlets too.
so Laura, just to clarify, when you make referrals, you're able to get kids into services quickly and there haven't been any problems with those referrals.
We have not. Now I can say that we haven't had any therapeutic referrals recently, but we've definitely had better luck in that area. But for other referrals, whether it's food resources, families with outstanding bills, rent assistance, things like that, we've had a lot of success.
Okay. What about your experiences with this kind of thing, John?
Well, I got to admit, I am not as detailed, have that kind of detailed information for the district as a whole. I know that our early childhood center has an extensive program for the kids who come on in, for the screening, for the referral to parents, for things like that. And that's been going very well. I've been talking to that principal a couple of times already, and she's very excited about the parent opportunities they've offered. They've had people coming on in and hooking people up that way. At the building level, for the older kids, I know there are things going on. I know that for a fact because I hear them. But as to how many we've sent out and where we've sent them out to, I don't have those details. I'm sorry.
Okay, but it sounds like you haven't been hearing about people having problems making connections, things like that.
No, it's been kind of again, when I check in with people, sort of, we had a serious outbreak of COVID basically across the entire district. And so I refused to go into buildings just because, didn't want to spread. So, we just sort of, we had staff out, we had kids out, we had all sorts of things going on that way. So I haven't really checked in. I did have checked in this month for some coming back from that. And again, stress levels for everybody is high, but at this time of the year, everybody's stress level has been high historically. So we're not outside the parameters of where we would be. And from what I'm hearing, the students are settling down a little bit more. There are less referrals, to anybody inside the district for help, that sort of thing. So, but no, I have not heard of anybody who's needed something and we've not been able to get it to them.
Okay, that's helpful. Ashley, I wanted to ask you, in terms of your experience as a parent and just talking to your parent mentors, what do people report from your perspective trying to get their kids into services, or parent mentors hearing about people trying to get into services? What have you heard?
I've actually dealt with quite a few parents where we try to get them the services in their area, and it's kind of hit or miss. Some might take a couple months. It depends if we're doing a local place or if we're using, for instance, Chicago as a location. Chicago is very, very hard. There's a waiting list for everything. We have used Aunt Martha's in the past, and we've used other services where I would personally drive them to different locations just to make it faster for them. So I think it depends on what it is, and it also depends on the location of where it's at.
You know what, and if I may say this, because I think it's also important. One of the reasons why we do our model the way we do is because, you still have to go through a primary care physician to access behavioral health. But one of the things that we're finding, Ashley, and I think this happens to all of us, is a lot of the need for behavioral health services when something critical happens, and the issue of timeliness becomes a barrier. And that's why, because we do all the screenings that I was telling you about, we do them with all the patients. We don't do them with behavioral health patients. Every single patient that comes to us has to go through that anxiety screening, depression screening. So we're not waiting until, someone wrote a note that there was some acting out or something. No. So that when those scores begin to look a little off, then we already have a history. But what happens is, because a whole lot of these kids are going to primary care settings where that is not necessarily being looked at, there is no history tracking it. The school may have it, but the primary care physician doesn't have it. So all of a sudden there is a need for a referral. And to your point, oh, we don't have anything for blah, blah months because the need is, you know, the supply and demand issue that Denzel was talking about is just, there's such disparity. So I just wanted to mention that.
It's a
Well,
good
that's
point.
that's a good point. That's a good point. So Ashley, where'd you go? Oh, you moved. That's the thing about Zoom, people move around. So what, when Ashley, we're talking about the difficulties you ran into, what are the chief obstacles that you mentioned? Wait lists. What are the other obstacles that you encounter?
A lot of it is the whitelist. A lot of it is also the fact that they don't know what they're doing. So you have to have certain paperwork, you have to have certain things filled out, and they get confused, and they're already in a situations where their emotions heightened and everything just makes it worse. So the process to get into the doctors, the process and to get into programs and stuff like that, Kenny said, you need, you know, referrals, you need to have like insurance papers filled out, you need to get this pre-approved through this, and it's just a lot for people when something is going on personally for them to take time and come down and read everything. They might make it to the appointment. I've had one person make it to appointment, thought she had everything and realized that she was missing one sheet, and she got appointment pushed an additional 2 months because of that one sheet that she was missing.
Mhm.
Wow.
Yeah.
Okay.
Yeah, that's very helpful as well, from a parent's perspective. I know, and I bet you in that situation, those are the type of things that'll make a parent just say, forget it. You know what I mean? So that's a harsh reality. Kelly McKeever, you have any input as it relates to waiting lists or the impact that the pandemic has had on your specific practice?
Oh, that's a long conversation, but in specific, that's a whole nother meeting. Specifically though to Aunt Martha's, because I'm in the south suburbs, and I had previously through another agency worked with them. And so I can say that, you know, I often would like to refer my clients to their psychiatrist in the Chicago Heights, the newer location out there. However, as I put in the chat, it does require that they change pediatricians or primary care physicians, and a lot of them don't want to do that because they have such history with their own. And so that becomes something difficult because we're so short on psychiatry out here. So I don't know if there's ever some kind of way in the future to be able to, I don't know, link or do something where clients can, I don't want them to have to bypass pediatrics or primary care, but we may have to creatively come up with something because there's quality psychiatry out there. The other thing is that kind of what Ashley was saying is having the case management to be able to work with clients and navigate that. I've hired people, it becomes an expense because me and another office has hired persons just to walk them through these processes, and you know, insurance reimbursement isn't there, so it's an expense. If there was some way to, I don't know if that's billable. We don't have that information as clinicians, et cetera.
Right.
Well, Project Launch has a family navigator program who can help guide families through that process of helping them know what the steps and everything like that. So Ashley, we can give you the information for our program to help with that.
If I could quickly add, it's not just knowing the steps, they really need you to hand hold and walk them through it. Like, it's not just, okay, these are a list of resources. They really need, especially in today's day and age, you to be three-way call with them on this process. And so, yeah, I'll just leave it there.
That's true. I would definitely agree. And then the spirit of being proactive and solution-based, we actually have, we want to introduce our Project Launch Caregiver Support Group, which specifically focuses on the caregivers and providing support for the parents. So I'm going to ask that Rose go ahead and share her document.
Yeah, I hate to break up the conversation because that was, I think we could talk a lot more about that topic, and maybe we can continue that on Jamboards and other places to have, because I think that this is important stuff. But yeah, as Denzel mentioned, I have become increasingly aware of all of those various barriers. And I think, you know, I'm trying to think of solutions that I myself can do. Our clinical program and a lot of the clinical programs in the area do have wait lists at this point for individual services, and often to the point that's been made before. Yes, absolutely, Dr. McKeever, I will. Yeah, by the time families are calling therapy services, they're already in crisis or they're near crisis situations. And then I have to say, you know, okay, well, like, good luck, and I'll talk to you in 3 months. You know, they don't know what to do. They're stressed, and even when right now with families where children aren't in crisis, there's significant stress. People are overwhelmed by all the demands that are currently being placed on parents and everybody. You know, do I send my kid to school with a mask? What's going on with the vaccine? All these different things. Now there's war looming, like, oh my goodness, guys. So while I don't have the capacity to provide individual intervention for each of the families that we come in contact with, I'm hoping that this group will be a good way to reach out and support families who are in need of a space to process or vent about the challenges they're currently facing as providers of care for young children. Connect with other caregivers who are experiencing these challenges, and also to learn some evidence-based parenting practices, which can help to support healthy child caregiver relationships, and also you know, learn some effective disciplinary practices. So you'll be receiving an email after our meeting today that will include a number of different pieces of information, but one of them will be an attachment that has this flyer. So the group is open to all parents, caregivers in the launch service area. So kiddos, families that have children who are 8 or under and reside in the Southland area. Please feel free to share this widely amongst your professional, but also your personal connections alike. It's open to whoever may benefit. It does have my contact info listed at the bottom of the flyer, so people can contact me if they have additional questions or if they want to sign up for the group.
Thanks, Rose. Real quick, today is Rose's 2-year anniversary with Project Launch and CRT. So I just want to say congratulations.
Thank you. Weirdest 2 years ever, guys.
Yeah, right. Okay, so we just want to say thank you to everyone. Sorry, I'm messing up. I'm messing myself up. I want to say thanks to all of you. Thank you, Kenny, for your presentation. Thanks, everyone, for participating today and working with us on all of this. Like Rose said, look out for the email that will have the Jamboard information, the caregiver support group flyer, and a link to our website and a link to our council newsletter that's coming out. And then look for an email from your subgroup leader as well. And then I just wanted to end with this. Please, no one sign off until I've done this. I'm so excited about it. The end.
Great job. Great job. Thanks,
Thank
everyone.
you so much.